The Free State Health Department is on a drive to restore the vision of visually impaired patients during the month of October. Universitas Academic Hospital's Ophthalmology Clinic is helping patients with cataract surgeries. The Cataract Marathon will see 30 operations performed a day to reduce waiting time for patients. The program is endorsed by the World Health Organization, which celebrates eye awareness during the second week of October. Professor Wayne Marais is head of Department of the Ophthalmology at the Universitas Academic Hospital, joining us for the conversation. A very good evening to you. Thank you so much for your time. Cataract has been described as a leading cause of blindness globally. Perhaps we should begin right there. What is a cataract?
Good evening, Paul, and good evening to our listeners. A cataract is layman's term is clouding of your intraocular lens. So your lens sits behind the brown of your eye, which is called the iris. And the main function of the lens is to focus images that's formed onto the retina so that one should have perfect vision. So when there is a opacification in the lens, we call it a cataract.
And you've set a very bold goal. You'll see 30 operations performed a day to reduce the waiting time for patients. How is this process going to work? And of course, also speak a little bit about who is eligible.
Yes. So the program, it's actually a long planning session. Is just not overnight. So we already start getting patients ready over the last year, and that is normally our elderly indigent patients, which normally patients that is at risk of developing cataracts. So it's not just the elderly. So any patient that has a significant cataract, we include in the program as well. And this is a community project and also a team. We get patients from across the province. We also do patients from Lesotho and our neighboring provinces, Northern Cape, as well as the Eastern Cape.
And what prompted this initiative? Because we do know, Professor Marais, that it's not a situation unique to just the Free State. I mean, Gauteng alone has a confirmed backlog for cataract operations, which has crept up to just under 14,000 people.
Yes, it's a national problem. And as you rightfully say, it's not just in the Free State. Our project actually runs since I've been a registrar. Registrar means a doctor in training to become a specialist. So we've started this program already in 2000, and there was also the campaign which they called the 2020 vision, where WHO wanted to eradicate blindness caused by cataract, which is reversible blindness, by the year 2020. And that's why we started with this camp with some of the backlogs that we have countrywide. And there is a criteria or thing that WHO sets for us is to form, we call it a cataract cut rate. You have to do a certain amount of cataracts per population. So in the Free State, our population, the past was between 2.5 to 3 million. So we need to eradicate the current backlog by doing at least 4,000 cataracts per annum. To make a dent.
So how is the process going to work in terms of the logistics? I mean, just a moment ago, you spoke about how this has taken quite a bit of planning, but in terms of your teams and ensuring that it's all smooth sailing and you do indeed reach your target, what processes are you working under?
Yes. So what we normally do is we pre-screen the patients, so that we know which patients require the surgery. We also then measure the patients, pre-operatively months in advance, so that we can have the correct intraocular lens. So when you remove a cataract, you have to replace it with a specific lens, which we implant then in the place where the cataract was already ocular. So all those measurements are done pre-operative in due time. So when the patient comes, all the processes are in place. Pharmacy normally arrange for us to have the necessary intraoperative devices, the knives, viscoelastic material, that's material that we put into the eye to protect the eye during the operation. We have the pharmacy supply already the amount of medication. And we have the main role played by our sisters, which then does the admissions in the wards, the clinics, post-op cares, and most of all, the surgery. So the surgical team in the theatre. And we have two running simultaneously, where each theatre then aim to do 15, 20 cases, which then amounts to the
Professor Marais, I'm hoping this line will hold for a little bit longer. It's not sounding very good on our end here. But in terms of the youngest patient, you say you may have had to operate the surgery on, perform the surgery, pardon me, what would you say is that age? Because one would assume that you'd have to be an elderly to need such an operation or perhaps even qualify for it.
Yes. As I explained, we don't exclude any patient. Preferably we do elderly during the Blitz marathon. But today we performed on a 12-year-old child, which bilateral cataracts. And those kids, the minors or children, needs then a general anesthesia, while the elderly are just done under local anesthesia, which is then quicker, faster. So your general anesthesia cases we normally don't do in a Blitz, but you alluded to the patient with the 12 years, which is a diabetic patient. One was a traumatic cataract.
Very well. Thank you so much for speaking to us this evening. We're going to have to leave it there for now. Professor Wayne Marais is the head of department at Ophthalmology at the Universitas Academic Hospital, joining us to expand on the Blitz there, ensuring that they do reach those targets.